The pandemic has forced many mothers to choose between their careers or their families. A Charlotte professor says that women are not only leaving the workforce to take care of their kids, but also struggling with their mental health.
WCNC Charlotte's Indira Esquiva looked at the possible long-term effects of this.
Dr. Margaret Quinlan told me that more women are choosing to put their careers on pause and focus on their families, a decision she says they wouldn't have to make if they had more support. Charlotte resident Travana Casey spent 15 years building a career in finance, a career the mother of two put on pause during the pandemic.
Just even thinking about returning to work, it just fills me with so much like anxiety and dread because it's like, well, how are you going to get everything done?
Casey considers herself lucky. She has a supportive husband and was able to take time off. At the same time, having to choose between her children or her career was tough.
When you're a mother, it's like you're giving all the time. But, my career was something for me that was separate from my husband and my children.
UNC Charlotte's Dr. Margaret Quinlan's latest book, You're Doing It Wrong, examines what mothers have dealt with for decades, now made worse by the pandemic.
People need to hear that women have been set up to fail, that the system is not set up for us to be successful, that if women were valued, if mothers were valued, this would have already been in place.
Dr. Quinlan says policies like wage transparency, publicly funded childcare, and matching work schedules to school schedules would all be steps in the right direction.
We need the support because we're drowning.
A study released by Oxfam earlier this year showed that the pandemic cost women globally $800 billion in lost income. In Charlotte, Indira Esquiva, WCNC Charlotte.